Welcome back to HealthWise. Once again, my special guest is Dr. Goerge Williams with us from the spinal surgeon, actually from Opelousas Healthcare Systems. And Doc, we were talking about the spinal cord regeneration or nerve regeneration, actually. Can you explain a little bit, because we kind of jumped over that, what exactly is the spinal cord and what is it composed of?
That's a good question. Your nervous system is divided up into two components, a central component and a peripheral component. The central component is the brain and the actual spinal cord. That is the terminal extension from your brain that goes down. It stops about your L1, L2 level, and then from it generates a series of nerves that go out to your arms and legs, etc. And that's called your peripheral nervous system once it leaves the spinal canal or spinal column. The spinal cord itself is consisted of it almost looks like a butterfly, if you will. It's composed of what's called gray matter and white matter. It takes tracts that's generated from your brain, both with what's called motor tracts. That's what delivers the capacity to move. And then from it goes sensory components or sensory tracts that allow you to interpret for your feel, vibratory, light touch, going to your brain so you can interpret it. So that's kind of a real overlay, if you will, but that's the major components of your spinal cord. Okay,
so in other words, it's like the pathways. Without the spinal cord, we can't do anything. You know what I mean? That's from the brain to every part of your body. That's the spinal cord is what protects the nerves. You know.
Yeah. Well, it's actually like, if you think about it, like pretend your brain is like a power plant. And then from it is cables that go to deliver the various power to the homes, etc. So from the power plant, which would be the brain, the big cables that leave the power plant going up to various inlet to a utility service system would be essentially the same function of the spinal cord. In other words, it's taking the power and the information from the generating source out to the delivery where it needs to be, but also it takes from it the interpretive tissue, the interpretive messages, that is your touch sensation, from your extremities, your arms, hands, and feet, back to the brain, so you can interpret what you're actually looking at, seeing, touching, feeling.
So it's like a two-way highway.
Exactly. That's exactly what it's like.
Both ways, yeah.
That's exactly what it's like.
Messages from the brain. Okay. So we were talking about injury, spinal injury. What about, not necessarily a severed spinal cord, but a bruise, spinal cord? That injury may not be as critical, or?
Yeah, it's a great question. It's really like anything else. It's multifactorial, but it really depends on, number one, the amount of force generated to injure the spinal cord. Like if you have like a young person who their anatomy is really normal, then it takes a pretty good force, like a severe motor vehicle accident or motorcycle accident. And then once it gets bruised, the spinal cord, it depends how bad the bruise is, because as the bruising resolves, hopefully not too much nerve tissue has been damaged. If that's the case, then your capacity to regenerate and go back to what you were before is great, as opposed to if the spinal cord is injured pretty bad, then the spinal cord actually will degress or degenerate and go into a form we call myelomalacia, where it gets replaced by almost the equivalent of scar tissue. But again, because of its lack of regeneration capacity, the function outcomes aren't as well as a spinal cord that's not injured nearly as bad.
Okay. We were talking also about where the injury was, and you just said the young. I guess my next question is, I assume you see elderly patients, and they tend to have less. I don't know the word I'm looking for.
Well, I'll tell you.
Results.
Yeah, in elderly patients, I tell you, when it comes to spinal injury, there's two big classifications. There's complete, that is someone who at the level of injury has no function below.
Right.
And those are devastating, and the ones we really can't do a whole bunch for, even though we're still striving.
Right.
And then there's what's called the incomplete injury. That's someone who, no matter what level of injury they have, they still have some type of function going below. and those are the ones that that hopefully over time may have a chance to recover, if you will. And from that, you have what's called the Brown-Séquard syndrome. That is someone who on one side of their body works great, but the opposite side is really weak. Those have actually the greatest capacity for recovery. Then you have what's called the anterior spinal cord syndrome. That's someone who on the highway of the spinal cord, the front part gets injured. And the bad thing about it is the front part of our spinal cord is where our motor function's at. And those have a really poor level of recovery. Then there's what's called the posterior column injury, which is the opposite. That's where the sensory function gets injured. It's still a poor recovery. But in elderly individuals, they usually get what's called a central cord syndrome. That is, what happens is that usually they have arthritis, stenosis, disc bulging, and so that they already have, instead of their spinal canal being nice and wide open like a young person, with the spinal cord in it, nothing's touching it, usually they have like a disc bulge or a spur, and so that those individuals, it doesn't take a whole lot to cause injury. They can actually slip, fall, bump their head, and that in itself can bruise the spinal cord. So that's why it takes a greater force to injure a younger person as opposed to an elderly individual.
Okay. All right. Well, Doc, like I said, we talked about that. After this brief message from our sponsors, we'll talk a little bit more about just general back pain, neck pain, and some of the things we can do to
Sure thing.
help that.